Namaste. My name is Clement, PhD scholar, Himalayan University. As per my topic, today I am going to orient and educate regarding asthma, definition and prevention of acute exacerbations of bronchial asthma. Let us understand the meaning of asthma, the definition. It's a chronic inflammatory disease of airways that causes airway hyperresponsiveness, mucosal edema and mucus production. You see the normal lung structure and how our airway looks, the bronchi and the bronchioles, the smooth muscles. This is normal airway, how does it look? And this is a typical airway of a wheezer without asthmatic episodes. You can see here asthmatic airway during an attack. So it is constricted, narrowed. See, generally you can see some swelling and inflammation and thick mucus production. All these things. So this is the pathophysiology. The normal airway which is patent, which allows the sufficient inspired air and expiration. It supports normal inspiration and expiration. This is a typical airway of a wheezer, and this is how it looks during an asthma attack. It is narrowed, constricted, having these wheeze symptoms during expiration. As we all know, and as already explained, the causative factors are mainly due to allergens. So you can see exercise-induced asthma, the pollens, the mites, bugs in the home, chemical fumes, cold air or environment, fungus, spores, dust, smoke, strong odors, pollution, anger or emotional factors, stress factors, and the pets at home. Okay, another picture representing the triggers. See, 90% are during exertion, means exercise-induced asthma. Then the smoke, either it can be primary or second-hand smoke. Then 50% from they experience symptoms from exposure to dust mites. Then 30% experience symptoms from pollen. Pollen means an airborne allergen that sets off numerous asthma symptoms. You may also see the pet at your home. 37%, they are classified into 35% triggering factors. They experience symptoms from pet dander. That means a combination of dead skin cells and hair of your pet animals at home. Then 55% of the total case or symptoms are experienced due to climate conditions, that is cold, wet or dry or sudden climatic changes also triggers the asthma or the hyperresponsiveness of the smooth muscle fibers of bronchi and bronchioles. We can see what are the clinical manifestations. The three most common symptoms, of course, cough, dyspnea, difficulty in breathing, and the wheeze, especially during expiration. Then chest tightness, and you can listen to the breath sounds. Wheezing, it is known as high-pitched whistling sound, which is known as wheezing. You can hear this whistling sound during expiration, also known as bronchi in medical terms. Then crackling sound, also known as rails. This sound is similar to bubbling, popping or clicking, generally audible during inhalation. So this sound is heard during inhalation. This is typical during expiration. Then, due to difficulty in breathing, the exchange of gases in the lungs, so it is not adequate, so that results in hypoxemia. So that means the less oxygen in our blood. So the signs are restlessness, increased anxiety, inappropriate behavior, increased pulse and blood pressure, and pulses paradoxus. A drop in the systolic pressure during the inspiratory cycle greater than 10 mm of mercury. Then diaphoresis, cyanosis, eczema, nasal discharges, crackles, increased work of breathing with use of accessory muscles, then tachypnea. Then how do we diagnose it? No investigation, of course, by taking the history from the child or from the parents. Then physical examination, especially the auscultation. Then pulmonary function, lung function test, the spirometry. So it's a device wherein you will be asked to expire forcefully certain amount of air or your lung capacity. According to that measurements, we decide what is your lung capacity. So that determines the amount of constriction or the suffering of a child during expiration or normal breathing pattern. Then pulse oximetry, then EBG analysis, and elevated serum eosinophils and elevated serum immunoglobulins, especially hemoglobin E. And of course chest X-ray and allergic tests are conducted to confirm the allergic reactions in the body or hyperresponsiveness, which indicate towards asthma. How do we manage this? The goals. Primarily, we promote bronchodilation, the reduce inflammation, remove secretions, prevent asthma attacks, and maintain normal lung function. In another video, wherein I have shown how to do the bronchodilation, that is with the help of aerosol, the nebulizers, or the beta adrenergic agonist or rescue inhalers. There are a variety of inhalers, especially the bronchodilators. Example, the commercially used Astham and Livolin. And to reduce inflammation, either you can do it in the form of nebulizers like budocortisone rescue or rescue inhalers like budocort, we call it as MDI, meter-dose inhalers. And remove secretions, it is not done at a home setup, it is done in a hospital setup. Then prevent asthma attacks. It is nothing but taking precautionary steps that avoiding of allergens and halting the next pathophysiology during the primary symptoms itself. Then maintenance of normal lung function. It is by normal healthy patterns, avoidance of allergens, and advised exercise and follow up. Those things will render you to lead a normal lung function. These are the pharmacological management. So basically, before that, you will see this avoidance of triggers is the best measure to avoid asthma attack and its exacerbations also. So in my separate video, I have gone the demonstration method. I have shown all the details of how to use a nebulizer and how to use a beta-dose inhalers. So it is mentioned here. So we use bronchodilators and the names of those medicines, then steroids, then mast cell stabilizers, then anti-inflammatory drugs. These are the names only. In that separate video, you can see what are the methods for maintenance of normal airway function. And all these are scheduled drugs, prescribed drugs. You have to follow according to your pediatrician's prescription only. Our physician is treating your child. No medication is taken voluntarily. Please ensure that you are following the prescriptions advised, be it for bronchodilators or corticosteroids or any of the anti-inflammatory or antihistamine medicines like your montelukast or levocetirizine antihistamine, anything of that kind. Please go according to the prescriptions only. Management and prevention of exacerbation of asthma at home and community. Now we are going to the detailed video wherein I have demonstrated the actual method of using the meter-dose inhalers. Remember, once again, the meter-dose inhalers are used. It is also known as rescue inhalers with the help of spacer also for a child who cannot hold his breath after the puff is given to him. Whatever. Again, once again, I want to remind you all that even the meter-dose inhalers or rescue inhalers, the puff advised according to your age of the child and body weight, it should be followed. It is not like that if symptoms are worsening, you are going to give the additional puffs or keep on giving the additional puffs. Such things shouldn't be done. Always stick to the doses and the advices given by your pediatrician or physician. This video will lead to the actual method of giving MDI and with spacer, without spacer, and usage of nebulizers and other things.